Do you know that you might be having events of loss of consciousness and shaking that are not epilepsy or seizures? 2 years ago, a 25-year-old lady came to visit my clinic to solve a mysterious issue. She was having lots of events of loss of consciousness and shaking, and she was having lots of issues with that, could not drive, she was hurting herself sometimes, and she was even worried to carry her 2-month-old baby. Everyone thought that she had epileptic seizures, and she was treated for that and visited many doctors over the years with no improvement, and she even had lots of side effects from the many medications she was given. I asked myself what could cause these events and what can we do to make the correct diagnosis. Let's go on a journey to make the diagnosis for my patient, and let's name her Alex. Come on and join me to be a brain doctor for a few minutes. You can do it. It's like Sherlock Holmes, who is investigating the case and getting the evidence from everywhere to make the correct diagnosis. So the first thing we consider is maybe it's a low blood sugar. So when the blood sugar drops, patients can feel tired and dizzy, and then after that they might even faint and lose consciousness, and then after that they will recover and be okay. But like Alex did not have diabetes and she was not taking insulin and she was eating well. So probably this is not her diagnosis. She might be having complex migraine. So complex migraine is, at the beginning, patients might have seeing stars and feeling it coming. Then during the headache, they can have bad, intense headache. They even can have like one side weakness of their body or numbness. And sometimes if it's very intense, they can lose consciousness. And usually when they wake up, they will wake up with bad headache. I think Alex also did not have complex migraines because she did not have headaches during that event. She might be having psychogenic non-epileptic seizures or non-epileptic events. So this is a specific diagnosis for people who have like anxiety at the beginning. Then they will go on having shaking events. Usually the shaking will be all over, like right and left and asynchronous. They can shake their head right and left. Usually the eyes will be closed. And then they can be emotional during the event with crying, and usually the events will last long time for longer than 10 minutes. They will not be able to respond, but after the event, they usually have intact memory of the event. They will tell you that I was feeling you when you pinched me, but I could not respond. So this is called non-epileptic seizures. Alex did not have those long events, and I think she does not have non-epileptic seizures. So let's consider epilepsy and seizures just for the sake of being complete. I think when people have epileptic seizures, at the beginning of the seizure, usually they will feel the aura, like this feeling weird or feeling that the seizure is going to happen that people describe. Then during the seizure, they will start shaking and like turning the head to one side, shaking in one arm, and then that will spread to the whole body. And usually the shaking is intense, associated with like frothing at the mouth, urine or bowel incontinence, to use the bathroom in themselves. And the time of the seizure usually happens in 1 or 2 minutes at the most. Very rarely to be more longer than 2 minutes. After the seizure, the patients will be confused, tired. Usually they have no recollection or memory of the event, and then they take gradual recovery. So let me give you a doctor's tip now. The seizure diagnosis or those events diagnosis might not be very straightforward, and your doctor might need to do many testing and doing some hypothesis and investigation work to reach the correct diagnosis. If you've been having lots of those passing out and shaking events, or your seizures not under good control, please make sure to visit an epilepsy center to be investigated well. And if you like this video so far, please hit the like button and make sure you use the pinky finger when you make the like so that it will spread to more people. There is one more thing that we did not consider yet. It is the heart. So the heart has electricity, and the electricity can go out of sync and out of rhythm. It's called arrhythmias. At that time, the heart will stop pumping blood correctly when the arrhythmia happens, and then that will decrease the blood pressure in the blood going to the brain. The patients at the beginning, they will feel lightheaded, dizzy, the vision will collapse, and then they can faint, collapse on the ground, and they can have like a little bit of shaking events. And then once the heart and the head is at the same plane, usually the brain recovers quickly, and then they will wake up right away with no confusion or memory loss. And sure enough, I checked her for that, we checked her heart, and we found that she did have arrhythmias. And we gave her medications for the arrhythmias, and the heart rhythm was in sync back, and she stopped having those events. And we were able to take her off of all of her seizure medications. She felt so much better after these medications were out of her system. And now she has no events, and she was able to carry her 2-month-old baby again. How much fun it is to be a brain doctor. Did you like the journey? Please let me know down in the comments below. There is no limits to how much an epilepsy patient can do. Please see this video for more information, and see you in the next one.